I've been with Age Management MD for about 4 months. I work with hormone replacement, supplements, how to exercise most efficiently, what type of diet works for that person, and it's individualized. Same thing with the exercise. And then I also help them with regenerative medicine. The catalyst for me was my own health and well-being, and I found that I was getting more out of shape and gaining weight, and it seemed difficult to lose the weight. It seemed difficult to gain strength, and just felt like I was deteriorating. What I found at this practice, this age management practice, is that there's a consortium of other practitioners with a similar mindset: diet, exercise, bioidentical hormones, and supplements. And those are all geared towards the patient from their lab findings and from other hard data such as body comp analysis. So this was a perfect fit.
Great.
Yeah, the term regenerative medicine basically means we're able to regenerate areas of the body that previously we didn't have the tools or understanding. Our body heals if we have an injury, and as we are very young, we can heal very quickly. So there's always a balance between degradation and repair. As we get older, because of our metabolics, the ability to regenerate after degeneration starts to decrease, and degeneration outpaces regeneration, and that's when we get deformities and loss of soft tissue. And we're promoting the healing of the body, the same that the body does. It's just that we're concentrating the same factors, and by concentrating them, we're getting better regeneration. My patients do very well with our regenerative procedures because we not only do the injections, but we also look at their overall health. They get a complete history and physical before any of these procedures are done, and lab work if appropriate. The lab work will allow us to figure out if there are metabolic issues that should be addressed to give them the best success. How long does the recovery take? It really varies on the individual depending on their metabolics and how healthy they are. If they're healthy, we could see changes within days. The main point, of course, is regeneration and decrease of pain. The pain is caused from degeneration, and if we switch from degeneration to regeneration, the pain goes away and the area heals. But we have seen people 4 to 6 months before they see the major results. But these therapies continue to work for over a year because it's your own body, your own stem cells, and your own regenerative processes that are occurring. Well, they need to know why I do this. I started out as a surgeon, and I realized I didn't like hurting people, so I became an anesthesiologist, which was a very, very rewarding career. After my anesthesia career, I started looking into regenerative medicine and age management medicine because it tied in with my pain management that I did as an anesthesiologist. And really that's what this is all about. It's about treating people with pain, getting them out of pain so that they can function normally every day and do what they want to do. This particular treatment option is safe, it's effective, and it's also a miracle because the regenerative processes that I have seen with this procedure are different than anything I've ever seen before. As an allopathic doctor, I look at a medicine is given, it has a certain effect, it has a half-life, it's excreted, it's out of the body, its effect is gone. These are taking your own cells, putting them in an area where they continue to grow, they continue to multiply, they continue to make cartilage or tendon or muscle, and that's not like any drug. And so you don't have problems with drug interactions, and it's just a very unique, very different method of healing that hasn't really been used